Hi, it's Megan. I'm doing my reflective journal entry assignment 3.1. So we're talking about the 3 case studies that we were discussing in the live, um, the recorded live this week, or last week, sorry. So my assessment of Amy, so as we know, Amy is an 18-year-old G1P0. And she's kind of had different intervals of calling. She was having irregular contractions and lasting different time intervals to start. So when she called on Thursday, there were 30 seconds, lasting about 2 minutes, and they were coming every 3 to 9 minutes. So definitely, my assessment on that is labor might be starting, or it could just be that baby is in a funky position. And at that point, since we're just on the phone, we can't feel. But that would be something where I would advise her to rest, not do a whole lot, save her energy, and allow baby to do its job, and to eat and take naps and call back with any questions. But if she can hold off until she's too uncomfortable that she can't do it anymore, then that's kind of a better sign, as well as to make sure and pay attention to contractions and making sure they're lasting a minute, and coming every 5 minutes or shorter. And that's what would be more considered like an active labor pattern. So we hear from her again Friday at 1 a.m. They're every 5 minutes, but they're not lasting very long. So I would definitely tell her, just keep resting. It's not quite time yet. And then hearing her back from her that they're lasting 50 to 60 seconds, that's much more of like a timeable, quote, normal labor pattern. So upon arrival, doing a cervical check, and she's only 2 centimeters, but 100% effaced, so that's great. And at 0 station, that's also great. And then finding out that baby is OP. So once we find that out, it totally makes so much more sense of why things are taking longer and she's having all these funky contractions and it's been a long time. So in our readings in chapter 15, it talks a lot about different positions and the OP position, and how in this case she's most likely taking what we call the long arc, so the 135 degrees around, into a better position for labor. So I would probably tell her it's not that you're not in labor, it's that your baby is just taking its time to get into the correct position. And usually once that happens, things will pick up and move forward. Because she's really needing labor support and she's really young, I might offer to stay for a little while just to give her kind of that peace of mind of feeling like we're doing something, because sometimes that's all moms need to know, is that we're kind of giving them more. And so I might just hang out for a little while, maybe an hour or so, and then I might say, okay, I want you to just rest, and call me if you have any more concerns or if the contractions change, and check in with me once an hour. And then based on those call-ins, determine when we go back. But I would not admit her for labor yet. As far as Bess goes, her labor pattern and what's happening to her body with her loose stool and bloody show, her patterns of 4 minutes every 90 seconds, her vocalizing, she seems to be like in a very like normal labor pattern. We had a mom that had a very similar pattern to this, and she'd also had a couple of kids, and it was very much like the centimeter an hour, just kind of by the book. And Bess, excuse me, definitely seems to be exhibiting those characteristics. In the article I read by the NIH, Stages of Labor, basically what they were describing at when we get to Bess's house and we do a cervical exam, and she's 6 centimeters, 90% effaced. She's definitely what would be considered in the active part of labor. I would admit her personally at this point, and I would stay, since we're at 6 centimeters. She's got a great labor pattern. And she's doing great with her movement and her walking, keeping her body going, not doing too much. She's doing what makes her comfortable. And I would stay. I would admit her and I would stay for that. And then there's Claire. Make sure I'm getting all of these points that you're wanting us to talk about. Sorry. And then there's Claire, who has had several babies. She's her patterning. So the way that I look at it, if she's having contractions every 3 minutes for 60 seconds, she's not able to talk through them. And based on the fetal heart tones, so the 130 as baseline, decreased during the peak of a contraction, and then increasing to the 140s and returning to baseline. To me, that tells me there's a little bit of head compression with contractions, like down in her pelvis, which I think is a good sign, especially because it's returning to baseline. So we're not worried or concerned over that. That's telling us that baby's getting down and in position, that the contractions are squeezing and pushing down, that in our book, the Oxhorn Foot, talking about presentation, especially by feeling her and she's OA, that's like kind of optimal for delivery. So we know that baby's head is just like in the right position and down in her pelvis. I think personally, based off of our readings and based off of what I've seen in birth and in clinic, or clinical settings, like in a birth setting, not actually in clinic, obviously. To me, even because she's refusing a cervical exam, I would admit her. I would say based on her pattern, based on the decels and accelerations and the pattern of baby's heart rate, based on the way she's acting during contractions, and considering how many babies she's had, I would call her active labor and I would stay. Especially because moms that I've got to have experience with, that go through this, a lot of times moms that have a lot of babies, their labor patterns are pretty quick, and they have these babies pretty quick. And I think that with the positioning of her baby and what we're seeing with our stats that we have of her, to me, I would stay, I would admit her, and I would call her active labor. And I really think that based on her positioning, especially like when we're reading our materials, that's like optimal position. So that's what I would do. So anyway, that's all.